and thank you for being with us. I'm from Tennessee. We have been absolutely inundated with phone calls since this came back. People are trying to get some clarity around your statement about a substantial portion of people in America being affected by this, because right now it looks like anybody that is doing business with you. And I will tell you this, the reality that hospitals and providers are facing is wildly different from the rosy picture that you have painted. You have made a statement recently that payment processing by Change Healthcare is at approximately 86% of pre-incident levels. This morning, you said that it was back to normal. And I will tell you this, there is a backlog that many of our providers and hospitals have from 9 weeks of not being able to get in and make these claims. We have, and here's a good for instance for you, a small independent private act hospital in West Tennessee. And they have diligently submitted all of their claims, and they are burdened with the backlog of Medicare claims that is equivalent to 30 days of revenue. And they're waiting for these things to be transmitted to Medicare. And this is all because of the missteps that you all have had. Now, every day they call to get an update. Every single day they're calling, and they get the runaround every single day, repeatedly. It is like you all can't figure this out. And the absence of Medicare electronic remittance is compounding the problem, and it's requiring that manual payment processing. And of course, this goes into labor cost. You've got error rates. So when can Tennessee providers and hospitals expect you all to clear the backlog, to catch up, and be back to normal?
Senator, thank you very much for the question, and I'm very sorry to hear the experience in your state of those hospitals. We will reach out to your office to find out the names of those hospitals. We will get connected with them.
Take every hospital, every provider.
So
we have hospitals that are pulling on a line of credit. Are you going to pay that interest? Are you going to reimburse that?
We are offering interest-free loans directly ourselves, and be more than willing.
No, I said, are you going to pay these interest costs? Okay, let me move on with you, because one of the surprises, and the chairman just mentioned this, is the lack of redundancies that you all had built into the system. Now, your revenues are bigger than some countries' GDP. And how in heaven's name did you not have the necessary redundancies so that you did not experience this attack and find yourself so vulnerable?
Thank you for the question. First and foremost, Change Healthcare had only recently become part of UnitedHealth Group. We were in the process of upgrading and modernizing their technology. The attack itself had the effect of locking up the various backup systems which had been developed inside Change before it was acquired. That's really the root cause of why it's taken so long to bring it back. And as I emphasize that we have worked to rebuild a brand new technical environment so that we know that it is modern and it's not infected from the attack.
Well, there may be excuses, but was there not a thought process put in place on the front end as you were going through this of how you would protect yourself from vulnerabilities?
Change Healthcare came into the organization just about a year and a half ago.
I'm fully aware of that.
We were in the process of upgrading their technology when this attack happened.
All right, there again, for whatever reason, short-sightedness and not having a plan to incorporate is let's move on. Optum, because it's widely acknowledged that Optum's temporary assistance program fails to adequately address the financial setbacks that are caused by this. Now, we've got one Tennessee provider that disclosed receiving a one-time payment of $8,000, significantly below their usual daily revenue of $20,000. And these providers have resorted to tapping into personal savings, retirement funds, seeking loans from banks. And so are you going to cover all of those costs that they have had to incur in order to keep the doors open because you did not have an appropriate backup plan?
As important as this question is, briefly, because we got a lot of members interested. Answer.
So, Senator, thank you for the question. Very happy to engage with those providers. We'll reach out to
We
your
look
office
forward to
get
the
them.
engagement.